Good evening, everyone. I'm Chris Lowe. I'm your town administrator.
And I'm Robin Hunter, and I'm the chair of the Board of Selectmen.
And we have the special honor this evening of introducing our special guest and MC of the evening. But before we do, we really just wanted to say a few words, and I can certainly speak to how helpful Denise has been to me in my role as a town administrator here for the past 6 months. But really more broadly, how helpful she has been to the community here, which has been really fantastic and a wonderful thing to see. So I remember when I first arrived, one of the first people to reach out to get on my calendar was Denise. And I thought, oh, this is great, it'll be a great get-together, maybe a casual thing, some coffee, some breakfast. And so we met across the hall in the selectmen's hearing room, and Denise brought Maureen with her brand new district aide, and got right down to business. Grilled me on what value I was going to bring to the community, what vision I had for the community, how I was going to help and get all these things across the finish line. But it was, it was clear to me how invested she was in the community. And the first thing that she wanted to do was really, aside from saying hello, was really just to get right down and see what we could do in terms of providing value and services to the community, which is a really wonderful thing. We had a wonderful conversation, and it really focused at that time on all of it was a great reflection of all the great work that's occurred in town, in no small part from Denise's efforts. As well as the great relationship the community has and has had with its legislative delegation, which is a really, really important thing. And she talked about her vision and a lot of her legislative priorities, which I won't get into because a lot of them are the crux of tonight's conversation.
It is her.
It is her. It is her vision. But the other thing I just want to add, aside from being a wonderful resource to me and a wonderful resource to the residents and staff, whom I run into often who say, I'm going to see Denise, or I have time with Denise, I want to work through this issue. She has always been there for them, and has always been there for me when there's been a tough thing or a project that's coming up that I just need some help on, some guidance on, and frankly, some support. It's been invaluable. But the other thing that I wanted to highlight that is, I think, really important and really impactful here is, my 6 months here, I've seen Denise bring back dollars directly to this community in the form of grant funds for things that cover and span public safety, capital planning, to money to help us improve how we operate internally and in turn deliver better services to the community. And without a doubt, without Denise there representing this community and fighting to bring those dollars to the community, we wouldn't be able to get those things done. And so I can't thank you enough for that. I'm honored to call you a colleague and have you as a partner here in really continue to provide the best possible services to the town of Dover. So thank you. Robin.
And I would just like to add, you are truly and you've had an open door for us at the town, and you know that we can rely on you to get that issues and provide us through some of the difficult challenges that we've had and will have. So we really appreciate your partnership.
So without further ado, our state representative, the Honorable Denise Garlick.
Well, I want to thank both Chris and Robin for that warm and wonderful introduction. Give you my word that I will work hard every day to be deserving of those words. I'm thinking that what came through very clearly in that introduction is how committed I am to the town of Dover, but it's because of the people that I'm working with. The Dover Board of Selectmen has been extraordinary, our Board of Health, our school committee, all of those entities that are working so hard together to make Dover what it is, the community that shares the values of all of the citizens of this town. I'm thinking of the Council on Aging as well. And I always look forward to my work with Dover. And I want to thank this wonderful room full of people on a January night. I think it's testimony to our growing relationship and our partnership. So thank you for that. As we begin this evening, this is my word to you, I will speak for 30 minutes. At the end of the 30 minutes, whether I am done with my presentation or not, so this will discipline me, we will immediately switch into the discussion period of the evening. The discussion of the period of the evening is so very important because not only do I get your feedback from the work that I'm sharing with you, but it helps me to set my work and my priorities for the upcoming year. So I wanted to let you know in the positions, just very briefly, for those of you who are just meeting me for the first time, I was elected in 2010, began serving in 2011. In that time, I am a nurse by profession. And I say to people now, not wanting to get into dates, that I was a nurse for about this long and I've been your state rep for about this long. But in that time, I have served on all of our healthcare committees. In my second term, I was the vice chair of the Joint Committee on Education, where I did work with Bob, when we talked about special education. In my third term, I was the chair of the Joint Committee on Elder Affairs, where I dealt with Janet and all the very committed activists in the town of Dover who are older adults. Last term, I was the chair of the Joint Committee on Mental Health, Substance Use, and Recovery, and was the chief author of the House of Representatives bill on opioids. And this year, I am serving as the vice chair of Ways and Means. I represent all of Needham, all of Dover, and half of Medfield, because a representative represents by population, and my magic number is 40,000. I want to let you know, and I think the introduction served itself, about the many ways that I connect with the community. And I guess after this lovely introduction, I would just like you to know that the ways I connect with the community are in person and in presence at the events that mean so much to this community, and in a variety of ways that people can connect with me by email or by telephone, office visits, in our students who come to the State House, and the times that I visit Dover's children in their schools. And one of the things that I have promised from the very beginning is that I share the issues and concerns of the people that I represent. And when I think particularly about Dover, not only in the conversations I have and with the guidance of the Board of Selectmen, and in my relationship now, my growing relationship with the town administrator, but Dover has also had a citizen survey. And when I was first elected, and something perhaps that we'll think about doing again because time changes things, is I was invited into the homes of people of Dover to sit down with people that were volunteers serving on the boards and on the committees, just to kind of have coffee and talk. And in that way, I have learned that the values that I think that are very important to the town of Dover, and on which I concentrate much of my work, is certainly around the water quality and sustainability issue that your town has come together to work on. Around education and schools, of course, I think it is one of the primary values of the town of Dover. The youth civic involvement, particularly I see this in the Dover-Sherburne school system, but the concerns around substance use, around protecting our youth. And every year I engage with Dover-Sherburne Middle School around their active citizenship projects. And I'm deeply moved by the students and their commitment to be active citizens. Certainly thinking a lot about healthy older adults and the many ways I engage, not the least of which is at Dover Days, I buy everything they're selling, so you could think about that. And supporting our veterans. And I'm looking forward to working with the town administrator in more ways that we can support our veterans. And when we talk about our veterans, we need to also think that about the spouses, who are also very deserving of the benefits that veterans have earned. And this is just an example of the many ways that you can contact me, and always available for breakfast at Fresco, and in any other ways that you think might be helpful. So I wanted to speak to you a little bit about legislative accomplishments, And I'm using this word around strong and stronger. When I first got elected, the Needham fire chief, who was a friend, he said to me, don't ever talk about strengths and weaknesses, Denise. Just talk about strengths and things that need to be strengthened. So when I think about my district, and more importantly, or equally, when I think about our Commonwealth, I think about what are our strengths and what are the things that we need to strengthen. So this slide here is a summary of the bills that have been enacted by the House of Representatives in this legislative session. A legislative session is 2 years. It begins in the odd number year. So this is all of the work of 2019 coming into 2020. The formal sessions will end on July 31st of this year. And I was going to highlight just a few of these for you that I believe are very important to our community. The first is certainly on the Student Opportunity Act. The Student Opportunity Act is the education bill that has been passed in the Commonwealth of Massachusetts. This is a historic bill and is the result of probably somewhere between 10 to 15 years of work where the Commonwealth looked at the education funding formula. What does it mean? It means it's $1.5 billion over a 7-year period for the students of the Commonwealth with a real awareness, and we are all rightfully proud that Dover-Sherborne is the #1 ranked school system in the Commonwealth. But we are also acutely aware that not every student in the Commonwealth has shared in that kind of quality education. So in targeting particularly low-income students, students from whom English is a second language, and special education students, the money looked at those communities where we saw a real achievement gap. For us in Dover, that $1.5 billion is not going to be a big chunk of money that comes to us. But as your representative, my work, and I have to share with you, this was very hard work, was upholding the principle that yes, we needed to do an education reform bill, but we should do no harm. We shouldn't rob Peter to pay Paul. We needed to find new revenue. And so in the final bill does no harm, but included in it is also ways that will help the community of Dover. And one of those ways, not so upfront and not the headline in the paper, but is that the bill addresses the health insurance needs of the employees and looks at the funding formula in a different way to alleviate some of that strain on the school budget. And it also deals with the health insurance retirement benefits. It also deals with the special education in ways where we look at the formula and we increase the money for special education and include transportation. Now this matters in Dover. This matters a great deal in Dover. We look at transportation and we also look at covering more instruction costs. And we also look at how we're going to phase that money in over a period of time. So this is something that I believe every person in the Commonwealth should be proud of. This education reform bill is a model in the nation right now, if the nation has the guts enough to stand by their kids, like we are in Massachusetts. The second one is the Modernizing tobacco control. For the non-nurses in the group, those are lungs. So the Modernizing Tobacco Control Bill was actually, it takes on average 5 to 11 years to pass a bill. Heaven help us, but that's what it takes. There's a lot of reiterations of a bill. There's a lot of stakeholders that are involved. But sometimes there is something that compels the intensity of the work around legislation. And for the legislature this year, it was the vaping issue. And it made the legislature move on a more quick timeline. And we had seen the number of people involved in the vaping. At the time we passed this bill, 3 people in Massachusetts had died related to vaping. Because we were doing the vaping bill, in my world, there's a phrase that you got to get on the vehicle that's moving. So the vaping bill was moving, but there was work around tobacco that needed to be done. So we combined that work. And in this bill, we banned all flavored tobacco in Massachusetts, including menthol. We taxed the vaping products at 70%, and we made sure that some of that money from that tax would go to our local communities through behavioral health and promotion trust funds. I love this story because when I was the chair of the Joint Committee on Mental Health, Substance Use, and Recovery, we wrote language into that bill to establish these trusts. I firmly believe that communities know best how to work on their issues. We can have a general principle about what an issue is and what we're trying to achieve, but different communities communicate differently, share information differently, and move issues in their own unique ways. So we need to have resources for those communities. So we wrote that into the opioid bill, but we didn't have money for it yet. And then in this Modernizing Tobacco Control Bill, we get the money to do those grants for our communities. So it pays to have a little longevity in the legislature. We are on the distracted driving ban. I'm pleased to see that Chief McGowan is here tonight, and Chief McGowan was actually very helpful to me as we were talking about legislation, not only in his input on what productive content would be, but his sense of urgency about why we needed to pass this bill. I heard from many people in the town of Dover about this bill. In the end, the distracted driving bill bans handheld devices. It does allow for some navigation devices. It does allow for use of devices in emergency procedures, but the work around the distracted driving was clear to everyone in the Commonwealth why we needed to do this. We have an epidemic of distracted driving, right? But there was a real holdup in the negotiations, and it was around stopping people if there was a concern that they had a handheld phone, that it would not lead to any kind of racial profiling. So after lots of discussions, built into this bill is a way that we can track who is being stopped and when they're being stopped, if they're given a citation. And if that data leads us to believe that some geographic areas are stopping people a whole lot more than other geographic areas, we can go back in and really discuss the issue of racial profiling. The Climate Resiliency and Renewable Energy Bill, this actually is something that's passed in the House, but it has not passed in the Senate yet. And this is a bond bill. But this issue matters to the people of Dover. Many people in Dover contact me about their concern about the environment and around climate changes and what it's going to mean. This bond bill is $1.3 billion for us to be able to address individual issues, and then there's $325 million that we may be able to do municipal things. I am hearing from your town administrator about issues that are important related to the environment and to energy, and so I look forward to the Senate voting on this bill and we can begin our work. And for district-focused legislation, I wanted to let you know there were over 6,500 bills filed. By the Massachusetts Constitution, every bill gets a public hearing. But of all of those bills, and people are still filing them even as I'm speaking to you, but of all those bills, we'll see really about 300 bills get passed. Of those 300 bills, it is likely that we'll see 3 to 4 dozen that impact our lives on a day-to-day basis. And the other 250, they deal with local issues with home rule petitions. But for us on the district, I have worked on the issue long and hard on Highland Ave, probably for the entire time that I've been elected, and that's around the Adeline project and the I-95. That makes life better for people who are using the highway. It's better for the residents of Needham, Dover, and Medfield that we have better access, if you can get there. I've worked on the issue of the Medfield Cultural Center, which I'm hoping is going to be over the border from Dover and will be a great amenity to this area if we can get that built. I've worked on an issue related to gathering critical data for medically fragile populations. There are many issues that I weigh in on given my own education and experience. For families in Dover, for families throughout the Commonwealth who have children with overwhelming medical issues, many of whom need 24-hour care in the home by preference of the family, we are under-resourcing the ability to provide those services. And it's a discussion that people haven't really been able to wrap their minds around because we didn't have sufficient data. So included in one of the budget bills, we ensured that we were going to have, excuse me, it was the child wellness bill, we ensured that we're going to be able to collect that data. And of course, the work around tobacco control. Coming up just very quickly, we've got people, Jerry Clark is in this room, who are working on the local and regional public health. Jerry's serving on a subcommittee. I am trying to pass the legislation that will codify the work that we have done in this Commonwealth. This work does not mandate any local Board of Health or any regional group to do anything, but it allows memorandums of understanding and our ability to find synergy and work together better, and it eases the pathway towards all of that. I'm working on an issue that's very broad and very overwhelming to me and everyone else who's trying to work on it. And it's around meeting the needs of the Health and Human Services workforce. When we think about the Health and Human Services workforce, we need to think about first the people they're serving, which is individuals with developmental disabilities, intellectual disabilities, mental health issues, older adults in the community, and the people who work in that workforce presently get paid through a rate scale at the state level. Many of these individuals are making $12 an hour. They work more than one job. They have to live far away from. I'm very connected to the Charles River Center through my family. The people who work there can't live in the Needham, Dover, and Medfield area. And we have to think about this rate of pay. And because the rate of pay is so poor, there's a great churn in this human services workforce. People come and go pretty quickly. In Milford, they opened an Amazon warehouse, and 13 people who worked in a nursing home next door left their jobs within a 2-week period. If we value the individuals that we say we are serving, and we value the people who are doing the work as a Commonwealth, we're going to have to step out and figure out how to pay these folks better and how we can actually build career paths for many of these individuals so they want to stay in that field. There's probably not a person in this room who either now or someday will be touched or by the human services workforce. We want to ensure that they're there and that it's quality work being done. And I'm working on an issue around improving this veteran survivor benefits. I alluded to this before, but I put it here so I could tell you this. There are things sometimes that I learn at the state level and I want to bring to my community. And then there are many, many things that I learn in my community and need to bring to the state. I was hanging out at the VFW with some veterans who were talking to me about their frustration around the annuity benefit that veterans receive or the veterans' spouses. There's a disconnect between the federal and state language. The upshot of this is that we wrote legislative language. We are moving this bill through the legislature. My dearest hope is we are looking at a Memorial Day piece of legislation that will improve the benefits for our veterans and their spouses. And it all started here at home, folks. So when we talk about the budget, I often talk to you about the budget as our values in action. It's also the strength is in our numbers, right? What we say is important to us. Let's look at what that number really is, and let's see if we're funding it appropriately. When we look at that, I'm just going to show you the ways that I look at this, and if something is catching your attention, we can go back and discuss this. But first and foremost, I do look at the Health and Human Services budget. By virtue of my education and experience, I am a trusted voice in the legislature around the issue of health and human services. I follow that budget as carefully as I can, and I advocate strongly on many parts of that budget. Part of that is around the substance use disorder work. This is an issue that we know impacts every single corner of our Commonwealth. We know that there are individuals who are suffering, we know there are families who are struggling, and we know the communities are straining, dealing with this issue of substance use disorder. And so we want to make sure that the money is there, and I am continually a voice about the money has to be community-centered. We work on the issue of environmental protection, and these are monies in the budget that we have passed, and we are moving forward on those issues. And some of them are small issues like the pollinator study, but the pollinator study actually matters to people in Dover who are beekeepers, and that small amount of money can make a big difference. Around local aid. So local aid is money in the budget. So you know that presently the Commonwealth has a $43 billion budget. We're looking at a much bigger budget in the upcoming year. Much of that money goes to the services in the Commonwealth, spread throughout the Commonwealth, but there is money that comes back as local aid. It comes back in two forms. One is Chapter 90, which is road and bridges money, and that's just given out on a formula. The other money is the local aid money, or it's called the UGGA, and it's the unrestricted governmental aid money that a municipality can use as it wants. Our Chapter 90 money in the last 2 years has stayed steady because of that formula. What's important to know about that is that it is used at the discretion of the town, and it can also be accumulated if you start to think about very large projects that the town wants to come take on. The local aid money, I want you to know, has increased from 1 year to the next, has increased every year that I've represented Dover. The school funding money, again, this is the money. We have two revenue streams of money in Dover, unlike Needham or Medfield. One is the money that comes to the Dover schools, which is the Chickering School, and the other is the Dover-Sherburne schools. And you'll see that there has been an increase in that money with the new education funding bill. As I said, I don't expect us to see a big bump in that final money, but we are going to see a small bump in the money, and we're going to see some of the pressure taken off that school budget. And Barry is here working with the Warrant Committee, with our Fire Chief Hughes, with the Board of Selectmen. We were able to secure in last year's budget $104,000 for a hydraulic lift for the ambulance. This matters for the people who live in Dover, and it matters for our volunteers in Dover. That ability to have that hydraulic lift instead of lifting a weight on a stretcher alone, right? To have that hydraulic lift, help with that lift, transport people safely, makes a difference in how the individual who needs care will be treated. And for those many Dover volunteers who are working with our fire department, we want to ensure their health and safety as well. So on the issue of leadership, I wanted to share two things with you. So right now, I am the vice chair of Ways and Means. So many people are kind of wondering, what does that mean? What does that mean to be the vice chair of Ways and Means? The Ways and Means Committee is the absolute nexus in the House of Representatives of policy and money, right? It is the place where unique bills that have an impact on the state's financial status, all those bills must come through Ways and Means. It is absolutely, when you think about 6,000 bills out here, right? And we're going to get down to about 300 bills down here. The smallest part of that funnel is Ways and Means. It is the place that I have worked long and hard to be, and the place in which I think I can make the greatest impact for us. So, in addition to being that vice chair, I have been asked by the Speaker of the House to take on an initiative which is a new and different way for the House of Representatives to take on a major issue. And that issue is around the Department of Children and Families, the issue around DCF. In the time that I have served in the legislature, we have increased the budget for the Department of Children and Families by 46.1%. It is now a $1.1 billion budget. It deals with 47,000 children in our Commonwealth. The headlines that you heard at one time that we didn't have enough caseworkers in DCF and the caseload was too heavy. Well, now we have enough caseworkers, and the caseload is 18-1, which is the lowest it's ever been. But we are not solving the major issues and the trauma associated with these children's lives. And over again, we hear of these overwhelming tragedies, just horrific tragedies. the Speaker of the House, we have a Joint Committee on Children and Families and People with Disabilities. We have a Foster Caucus, which is my colleagues, one of whom was a foster child, two of whom are foster parents. Those groups have been working together, but I have been asked to pull this all together and develop a strategy for the Commonwealth of Massachusetts. And the way I'm thinking about that with my incredible staff is looking at the major principles of prevention, which DCF has not dealt with at all because their focus has been on protection, and it's been their sole focus is around protection of children. I think we need to speak about prevention as well. And then permanency is the final decision for a child about where they can be so that they can grow and thrive. And permanency, the Commonwealth's first goal has been reunification with the biological family. If not that, then they're looking for kinship families that research tells us children do well with their kinship families, but there are also adoptive families. The difficulty with that is it's taking anywhere between 2 and 5 years for those decisions to be made. For some children, that is their lifetime. We can do better, and I'm hoping that I will be part of the solution on how to strengthen the Department of Children and Families. I also briefly was the co-chair of the Corrections Commission. The Corrections Commission, I put it here because I want you to understand this matters to us because the Norfolk County Jail is in Dover's backyard. But the Corrections Commission came out of this real concern about the amount of money that is in the Department of Corrections, which is the prisons, and the county jail system. But we layer on that concern, which has always been present, but we layer on that the work of the Criminal Justice Reform Bill in the state of Massachusetts and our rising awareness around substance use disorders and medication-assisted treatment in the county jails. So although I'm not going to continue serving on this commission, I am going to continue to monitor this commission. And the idea is around setting in place practices where we're making the best use of our money, that the money is being used to help reduce recidivism. Recidivism is when you are incarcerated, you are released, you commit a crime, and you go back. And in the ways that people are treated in those facilities so that they can build their lives as they're released. On the policy and budget issues to watch, these are everything that you're hearing in the news. I would tell you it is my sense that we're going to concentrate on transportation and healthcare. The budget looking forward will be all of these issues, and I have targeted things directly to some of the work that we want to do in Dover. We've talked to the chief about microwave technology around emergency communications. We all know that there are spots in Dover in which we can't communicate well with each other, and I am consistently a big fan of one of the best, smallest libraries in the country, which is our Dover Library. And I am doing television shows from home to the Dome. I think that's very catchy. But Needham, Dover, and Medfield have extraordinary cable television stations, and I am trying to connect experts at the state level with leaders in the community for a half-an-hour discussion on major subjects. And finally, I wanted to say thank you to our Dover Sherburne Cable Television, always welcoming, always taking good care of us. And I wanted to share with you, not to brag, but to let you know that I'm working hard and people are recognizing that work beyond our own community. And I'm very proud of the work that I'm doing in those various fields. And I want to say thank you to my staff. This is Maureen Callahan, who is my legislative aide. Colin, if you would stand up, this is Colin Feeder, who is my chief of staff. And this is Isabel Lane, who is also a legislative aide. And we have another gentleman, Philip Lynch, who's the legislative director. These staff members are extraordinary, in my opinion. I've worked with some wonderful, wonderful people. This is by far just a unique and wonderful team who cares about public service as deeply as I care about it. So I wanted to say thank you to them. That little chime you hear is the end of my 30 minutes, and I think it's the end of our slides, right? So I think we just have contact information here. Big news for Dover. We're launching our new website tonight. which is Rep Denise Garlick. More information, more in depth on these issues and concerns. And with that, we will open this up to our discussion. One of the things that we did, and Isabel, I believe we asked people if they had any questions, if they'd submit their names. So we didn't get any reservations to ask questions. So I'd like to open this up to questions or discussions now, if there's anyone who'd like to share something. Hi, Janet. Thank you. No clapping till we get through the question part. This is the tough part.
Thank you. Hearing a lot about the nip bottles, which we have a tremendous issue here in town with the litter from them. And I've done a survey with one and only liquor store. The nip bottles are their largest volume, unit volume of sales. And I've learned that a six-pack, an equivalent six-pack of nip bottles, equivalent of a bottle, is cheaper to buy in nips than a bottle. And so it's my understanding that the state is now looking at a deposit on this. Have you heard that?
So there's pending legislation on that, and I did not attend that public hearing, but I'd be very interested in the committee that's dealing with that and how they were addressing that. I have to tell you though, Janet, it's counterintuitive to me that the 6 nip bottles would be less a cost than, that goes in the face of all economies of scale that we know. But I have to share with you, one of my colleagues is the rep from the Cape, Rep Dylan Fernandez, and it is one of his major issues and is a great concern on the Cape, so we should be hearing more about that. Thank you. Any other thoughts? Yes, Chris.
Representative, so without a doubt, I think, it's clear that the community here has placed a great emphasis on land and open space preservation. Certainly probably the best in the metro and greater Boston area. And it's a goal of the community to certainly pursue this moving forward. And I noticed in your presentation you referenced that the CPA, looks like the legislature is contributing more funds in the state match to that. Is that something that you anticipate will increase over time, because the CPA match from the state has dropped considerably since it was first rolled out close to 20 years ago?
So the CPA is the Community Preservation Act, and there is a tax that is assessed on a local area by their own choice through a vote of the people who live in the area, and then the state matches that money. In the beginning, when we were first trying to launch the program, the match was very high. At one point, it was actually 100%. Now, the match has dropped as low as 30%, and we are working hard to increase that back up again. I believe there's a commitment to that, given a good economy, that we'll continue to do that. 100% match is great. If somebody said to me, for every dollar you give me, Denise, I'll give you an extra 30 cents, I'd take that deal. And to know that we're increasing that makes a difference. This is at the heart of the belief that there are things that a local community knows that they need that you're not going to see reflected in the state budget, but that you can work for your own community. And I'm committed certainly to making sure that that money continues to increase and that it's a good incentive for communities that want to engage in that program. Hi. Absolutely.
Sorry. First of all, I have to thank you for coming and speaking to us tonight, Representative Garlick.
Thank you.
And I am a 14-year-old immigrator from the town of Dover, and I want to make a change in my town. What do you recommend to all 14-year-olds who want to see change in their town?
And may I ask you your first name?
Walker.
So Walker, I want to tell you that I think you're making a difference already. I remember meeting you at the Dover-Sherburne. Walker is a prime example of, I visited the Dover-Sherburne Middle School the day before Thanksgiving talking about active citizenship, and we engaged in a very thoughtful discussion at that time. I've received an extraordinary email from you about Medicare for All, and I appreciate how thoughtful you are. I want you to know, for a 14-year-old, Dover is actually the home of active young citizens. And I would reference this very quickly around the plastic bag ban. I worked with some students in this town, as did many other people, the Board of Selectmen and the Board of Health, around a plastic bag ban. They wanted to work on the plastic bag ban. They went out and they found other people who were concerned about that issue. I'm sure they met with the moderator. They came to town meeting and had a very thoughtful presentation. And the Dover town meeting voted to support the plastic bag ban. There is no limit, Walker, to what young people can do. And I think what it takes is you have to care about an issue. You have to have a process that you're willing to follow, and you have to engage as many people as you can in that. And Walker, I have no doubt that you're going to be able to do whatever you're setting your mind to. No doubt. So welcome. And your friend is?
Oh, hi, I'm Liam.
Hi, Liam.
I actually have a question, and it's, I've been hearing that there's a lot of controversy on what to do with the community center, and I just want to know what your personal feelings that should be done about it.
So I'll tell you how I handle my role as state representative. So number one, in all the time that I have served Dover, I have been deeply committed to the older adults of this community, and to understand, to listen carefully and understand what it is they believe that they need. I am waiting for Dover to decide what to do, and then I will contribute all of my energy and my passion and anything I can help to do around resources to the decision that Dover makes. I feel as the representative, it is not for me to decide for Dover, it is for me to help Dover. So I take that word representative, to me that is a verb, and I take that very seriously. So offline, Liam, I'll be interested to see what you think about what we should be doing to that community center. Other thoughts, folks? Hi.
Hi, I'm Cheryl.
Hi, Cheryl.
Concerns around water.
Yes.
And I believe that the meeting was made with Mr. Day, and it's going to incorporate it and take it offline, but I was wondering if there are any updates or status around volume water in particular, and concerns around quality and quality.
So Cheryl, I'm going to answer you in much the same way that I answered Walker and Liam, in how I view my role as the state representative. So I am very interested in the work that the town of Dover is doing related to water quality, water sustainability. And I commend it to the Board of Health, from which we have seen this initial work come. The Board of Selectmen has engaged in the issue around Dover's water, and there's a Dover Water Committee. Maureen, as my legislative aide in the district, has attended all of the Water Committee meetings, and you may know that there were trainings around, just for us all to understand, when we're talking about water, what we're talking about, and what those terms are, and how the town was looking at this. For me, my role, my magic power, I do have a magic power as your state representative, and my magic power is that I can broker meetings. And so I am very thoughtful about what Dover wants and needs and how they're going to move. And I believe at that time I can be the most helpful in brokering those meetings with the state agencies or with other executive branches that we have to, that we may need to better understand the issue, to get more technical support, to be able to look at the issue, particularly around water quality. In small part, Chris had talked about my work on helping us to get grants. We did get a grant through the Department of Environmental Protection around even just the way we were going to hold on to the records of our understanding of water and the workings of different companies and in the town of Dover, and so that we could have a good archive about understanding where we are so we can figure out where we're going. But I would be remiss if I didn't refer you to the extraordinary people in this room who have worked long and hard on this issue of water, and would really recommend that you check in with those leaders. Yes.
Denise, I was pleased to see that you're working on increasing benefits for veterans surviving spouses.
Thank you.
I was wondering whether it would be possible to enhance the resources that are available to surviving spouses who are disabled, because there's such a maze of regulations that the surviving spouses have to navigate their way through dealing with the VA, really morass. And then also the Social Security disability morass. And it's very difficult for people to get competent guidance to navigate through those regulations. I think it would be very helpful if the veterans representatives in various towns could educate themselves with respect to those regulations and provide guidance to the veterans and their spouses.
So I think so too, Jim. And one of the things that gets lost in this discussion is when we're talking about veterans' benefits, we oftentimes don't think about the spouse at all. And, I have had people say to me, well, we don't have that many veterans in Dover. Well, we do have many veterans in Dover, but we also have many widowed spouses who are deserving of those benefits. So one of the things in our initial discussions with the town administrator is Dover does not have a veteran service agent here, or a person who's designated just to the work of Dover, joining in some kind of joint agreement. And I believe that we're going to work on that much more thoughtfully. Senator Mike Rush is an active duty Navy, and it's very important to him as well that we help to strengthen Dover's work around veteran services. But Jim, it is heartbreakingly difficult to get through the veterans' benefits in our own family, looking for a benefit for my father-in-law who was dying. It took us more than 4 months to get that paperwork even recognized, and it never was approved before he died, never, when those services were desperately needed. So I share your real concern about that. We won't even start on Social Security. But I do believe that there is a real openness on the part of your Board of Selectmen and your town administrator to strengthen the information in our town for veterans' benefits. And it's something that we can do with the Council on Aging as well. Thanks for that question. Other thoughts? So I guess let me just summarize this with the one thing that I did think that we might be speaking about that did not come up in your questions, and that is around the issue of transportation. I think on the news and in the newspapers in the next couple of weeks and months, there's going to be a tremendous amount of discussion around transportation. And I just wanted to let you know how the House of Representatives is addressing that. Because once again, we were talking at the very beginning of, in the reception time, about how we all have to stay young, we all have to think in new ways, we all have to keep moving. I am seeing that in the House of Representatives too. In dealing with major issues, you often have a committee that is designated to that subject area, and the chair of that committee is the leader in that discussion, and then meets with the various levels of leadership around how we would move forward on a major issue. Presently in the House of Representatives, there's 160 representatives. We meet as colleagues in caucuses. And caucuses are small groups of reps that come together on a specific issue. And you can be, I'm probably in 11 or 12 different caucuses. I'm in the Metro West caucus with my colleagues from these Metro West towns. I'm in the Elder caucus for older adults. I'm in a caucus for people that are concerned about special education. I'm in the Women's Legislators caucus, right? And these groups are very fluid, and they come together and they deal with issues. Well, to deal with the issue of transportation now, for the very first time, these caucuses that are informal are being called in to discuss the issues of transportation. And this matters because for 160 reps, when we're talking about transportation, we are not only talking about the MBTA in Massachusetts. We have to talk about the MBTA. I will continually talk about the MBTA commuter rail. But we're talking about the fact, for me, this is what I bring to my caucus. In the town of Needham, we have a bus. We have one bus that runs through the town of Needham. The scheduling and the stops don't make a whole lot of sense, but mostly I fight to keep the bus. It's hard to keep the bus. We've got the commuter rail. In Dover, we don't have a bus. We don't even have the ride here in Dover. We don't have the ride. In Medfield, we have no public transportation. We have to think about, so certainly the public transportation we have to think about the roads, right? For all of us in this room, likely the way we go into Boston, unless we're really clever, is we're going down the Mass Pike. We're paying a lot of money on the tolls on the Mass Pike. There are other roads in the Commonwealth that aren't tolled. In my caucus, we're saying, geez, maybe we should talk about tolling other roads. And we're talking about, there's talking about redoing the Alston-Brighton area. That's a 10-year construction project that will just boggles the mind to even think about that. But what it does to the commute for the people from Dover, Needham, and Medfield is overwhelming. How are we going to address that issue? My colleagues who are from the Berkshires and from Pittsfield have unique and different needs. Yes, they know we have to raise money for transportation. Yes, they know we need to support the MBTA, but they're also talking about rural transportation and what that could look like. Down the Cape, again, it's rural bus systems and what to look at. We know that for people to age in place, they need two things particularly. They need housing and they need transportation. And so this transportation issue is going to be major. I like that we're involving 160 representatives in the discussion. I like that we're thinking a lot about not just Boston and Boston's needs, but we're thinking about suburban needs and rural needs. And I don't know tonight where this is going to end up. I know we're all going to have to pay more for transportation, and I know we have to figure out what that looks like. But mostly I know that we have to have a good plan for our Commonwealth that is sustainable now and into the future. Everything depends on being able to get people from one place to another, their quality of life, their ability to work, and the economic development of the Commonwealth moving forward. So as you're listening to that discussion going on, please feel free to contact me. Please feel free to weigh in on that, and particularly what might be helpful here in Dover. Yes?
Actually, I have a compliment.
Oh, thank you.
We used to drive into Logan for years, lived there over 40 years. The last 5 years, we've given up driving into Logan, congestion behind the expensive parking, etc. So we are now converted to Logan Express. I would say the only thing that is big and fine, the buses, I think, work very well. I think they're clean and they're competent bus drivers. The only thing I would suggest is building their parking lot. Seems to me it's pretty getting popular, and at key times during school vacations and stuff like that, metro or go parking. Occasionally, I have a system issues but in general, I think it's very good. I also want to give a shout out today. I renewed my license at the registry of Renewable in Watertown. I waited all of 35 minutes from the time I entered to get a license, and I thought, very good. So there you go. What can I tell you? I have a lot of criticisms on the route.
So I'm going to stick with the idea of compliments for a minute. So this is what I want to share with you. I know that there are so many issues and concerns that individuals have related to their own families that we might think about for our town, and is overwhelming when we think of national issues right now. I have said before, and I will say it again tonight, there is not a morning I wake up that I don't worry for my country. And there is not a night I go to bed that I don't put my head in the pillow and thank God I'm in Massachusetts. So when we talk about this education bill, this is landmark, this is historic, what we are trying to do in education reform in our Commonwealth. We have the strictest gun laws in the nation. We rank #1 in life sciences in the country. When we talk about veterans benefits, Massachusetts has the best veterans services and benefits of any state in the nation. So I know we've got a lot of work to do. I know we need to do that work together, but I'm hoping that you are proud of your Commonwealth. I'm hoping that you feel that your state is strong. I'm hoping that you feel and love your community, which is so deserving of that feeling of home and the work that people in this town do to make every resident in this town feel like home. And I'm hoping that you, like me, believe that Massachusetts is the place to be. So thank you. So thank you very much, everyone.
Everybody has to take a cookie before they leave.
And Maureen would like everyone to take a cookie on the way out.
Please.
Fabulous. Oh, good. Chris.